Welcome to Drugs in Dermatology. In this video, we will be discussing the anti-interleukin 17 agents. This class includes 4 important agents with dermatologic FDA approvals: secukinumab, ixekizumab, bimekizumab, and brodalumab. An important note is although this class of drugs may be utilized for a wide range of treatments, we will be looking through a dermatology lens, focusing on dermatological diseases that are FDA approved. So, let's break it down. Drugs in dermatology style. The interleukin 17 family of cytokines plays a central role in the pathogenesis of psoriasis. Interleukin 17A is produced primarily by Th17 cells downstream of interleukin 23 signaling and acts directly on keratinocytes to drive epidermal hyperproliferation, barrier disruption, and the release of chemokines that recruit neutrophils and sustain chronic plaque formation. The interleukin 17 inhibitors directly interrupt this final effector arm of the psoriatic inflammatory cascade. Secukinumab, brand name Cosentyx, developed by Novartis, was the first interleukin 17 inhibitor approved for dermatologic use. It is a fully human IgG1 monoclonal antibody that selectively binds and neutralizes interleukin 17A. In the erasure and fixture trials, it achieved results that dramatically exceeded what had been seen with anti-TNF agents and ustekinumab at the time. Ixekizumab, brand name Taltz, developed by Eli Lilly, is a humanized IgG4 monoclonal antibody that also selectively targets interleukin 17A and additionally binds the interleukin 17A F heterodimer. It is notable for being among the fastest onset of action in the class. Bimekizumab, brand name Bimzelx, developed by UCB, is the newest and most efficacious agent in the class, distinguished by its dual inhibition of both interleukin 17A and interleukin 17F. This broader blockade achieves PASI 100 rates of approximately 70 to 75% in phase 3 trials, which is the highest complete skin clearance rate among any interleukin 17 inhibitor. Brodalumab, brand name Siliq, developed by AstraZeneca and eventually licensed to Dermatologics, takes a different approach. Rather than targeting a cytokine, it targets the interleukin 17 receptor A subunit, thereby blocking all interleukin 17 family members that signal through this receptor, including interleukin 17A, interleukin 17F, interleukin 17C, and interleukin 17E. This provides the broadest interleukin 17 blockade in the class. Unfortunately, it carries a boxed warning for suicidal ideation and behavior, and is available only through a risk evaluation and mitigation strategies program, which significantly limits its clinical uptake despite its strong efficacy profile. The anti-interleukin 17 class was built on the scientific foundation laid by previous biologics, which demonstrated that targeting the interleukin 23 Th17 axis was highly effective in psoriasis, and prompted investigators to ask whether targeting interleukin 17 directly would achieve even greater efficacy. Secukinumab was the first to cross the finish line, receiving FDA approval on January 21st, 2015 for moderate to severe plaque psoriasis in adults, becoming the first interleukin 17 inhibitor ever approved for any dermatologic indication. Eventual FDA approvals expanded its use to psoriatic arthritis and pediatric plaque psoriasis in patients aged 6 years and older. In 2023, secukinumab received FDA approval for moderate to severe hidradenitis suppurativa in adults, becoming the second biologic approved after adalimumab. In March 2026, this hidradenitis suppurativa approval was expanded for use in patients aged 12 years and older. Ixekizumab received FDA approval on March 22, 2016 for moderate to severe plaque psoriasis in adults, approximately 14 months after secukinumab. Its eventual approvals expanded use to psoriatic arthritis and pediatric plaque psoriasis in patients aged 6 years and older. Brodalumab received FDA approval on February 15, 2017 for moderate to severe plaque psoriasis in adults who have failed or lost response to other systemic therapies. Its approval pathway was complicated by the suicidal ideation signal identified in clinical trials, including 4 completed suicides, which led to the boxed warning and mandatory risk evaluation and mitigation strategies program. Brodalumab currently has no additional FDA-approved indications beyond plaque psoriasis. Bimekizumab was the most recent, receiving FDA approval on October 17, 2023 for moderate to severe plaque psoriasis in adults. The FDA label also now includes approvals for psoriatic arthritis and hidradenitis suppurativa. Secukinumab holds 2 FDA-approved dermatologic indications: moderate to severe plaque psoriasis in patients aged 6 years and older, and moderate to severe hidradenitis suppurativa in patients aged 12 years and older. Ixekizumab holds 1 FDA-approved dermatologic indication: moderate to severe plaque psoriasis in patients aged 6 years and older. Bimekizumab holds 2 FDA-approved dermatologic indications: moderate to severe plaque psoriasis in adults and moderate to severe hidradenitis suppurativa in adults. Brodalumab holds 1 FDA-approved dermatologic indication: moderate to severe plaque psoriasis in adults. All 4 agents target the interleukin-17 inflammatory axis, but at different points and with different breadth of coverage. Interleukin-17A is one of the most extensively studied cytokines in psoriatic pathogenesis. Produced by Th17 cells primarily and innate lymphoid cells, it signals through a receptor complex composed of interleukin-17 receptor A and interleukin-17 receptor C subunits expressed on keratinocytes and other epithelial cells. After binding, it induces keratinocyte hyperproliferation and the production of pro-inflammatory mediators, including interleukin-6, interleukin-8, CXCL1, and antimicrobial peptides that perpetuate the chronic inflammatory cycle of psoriasis. As seen here, secukinumab selectively binds interleukin-17A and prevents its interaction with the interleukin-17 receptor complex. Ixekizumab also selectively binds interleukin-17A and additionally binds the interleukin-17A F heterodimer, neutralizing this additional dimeric isoform that secukinumab does not directly block. Bimekizumab provides the broadest cytokine level coverage in the class by neutralizing all 3 biologically active interleukin-17 dimers, including interleukin-17A, interleukin-17A F, and interleukin-17 FF. Interleukin-17 F independently activates pro-inflammatory signaling in keratinocytes and fibroblasts, and its additional neutralization is thought to account for the superior complete clearance rates observed with bimekizumab compared to selective interleukin-17A inhibitors. Brodalumab takes a different approach by targeting the receptor rather than the cytokines themselves. By binding the interleukin-17 receptor A subunit, which is the common signaling component shared by multiple interleukin-17 family receptor complexes, brodalumab simultaneously blocks signaling from interleukin-17A, interleukin-17F, interleukin-17C, and interleukin-17E, also known as interleukin-25. This method provides the broadest interleukin-17 blockade in the class. The interleukin-17 inhibitors share a class-wide adverse effect profile driven by their mechanism. Inhibition of cytokines critical for epithelial host defense, in particular against Candida species. Across all four agents, the most consistently reported adverse effects are upper respiratory tract infections, nasopharyngitis, mucocutaneous candidiasis, injection site reactions, and rare inflammatory bowel disease, both new onset and exacerbation. Each agent has a clinically distinguishing adverse effect worth highlighting. Secukinumab risks rare neutropenia and elevated liver enzymes. Ixekizumab is notable for its high rate of injection site reactions, occurring in up to approximately 20% of patients, the most frequent in the class. Bimekizumab carries a substantially elevated rate of oral candidiasis. Brodalumab's defining safety concern is suicidal ideation and behavior. However, a definitive causal relationship has not been established, but ongoing mood monitoring is necessary in all treated patients. Across the class, shared contraindications and precautions include known hypersensitivity to the active substance or excipients, which is an absolute contraindication for all four agents. Tuberculosis requires mandatory pre-treatment before initiation for all agents, and inflammatory bowel disease concerns vary in their classification by agent. For secukinumab, active inflammatory bowel disease is contraindicated per AAD and National Psoriasis Foundation guidelines. For ixekizumab and bimekizumab, inflammatory bowel disease is a relative contraindication. For brodalumab, Crohn's disease is an absolute contraindication. Remember that brodalumab carries a mandatory risk evaluation and mitigation strategies program requirement due to the suicidal ideation and behavior boxed warning. Prescribers must be certified through the SELEC Risk Evaluation and Mitigation Strategies program. Patients must sign enrollment forms acknowledging the risk, and dispensing pharmacies must also be certified. A history of depression, suicidal ideation, or suicidal behavior is a relative contraindication for brodalumab, requiring careful individual risk-benefit assessment. Live vaccines should be avoided during treatment with all four agents. As always, we will close our video with a table going over the main talking points. Our four treatments: secukinumab, ixekizumab, bimekizumab, and brodalumab. I hope you have a better understanding of anti-interleukin-17 therapies. This is meant for educational and informational purposes only and should not be used as a substitute for medical advice, diagnosis, or treatment. Thank you for watching, and see you in the next video.